Hello, today we will be discussing kidney stones, or better yet, nephrolithiasis. Topics of discussion will be etiology, anatomy, statistics, diagnosis and treatment, and prognosis. Etiology. Kidney stones or nephrolithiasis often have no specific single cause. However, several factors may increase one's risk. Kidney stones form when urine contains more crystal-forming substances such as calcium oxalate and uric acid than the fluid in your urine can dilute. Nephrolithiasis are small, hard mineral deposits that form inside the kidneys. The stones are made of mineral and acid salts. Kidney stones can affect any part of your urinary tract. This means from your kidneys to your bladder. Here's a nice picture of a kidney that is about to cause somebody a lot of pain. That's the one on your left. The one on your right, it shows all the different kind of stones you could have and where they might be inside of the kidney. Description and characteristics. Knowing the type of kidney stone helps determine the cause and may give clues on how to decrease one's risk of future kidney stones. Calcium stones form from calcium oxalate. It's actually found in foods produced by the liver. High doses of vitamin D, meaning dietary. People who have history of gastric bypass surgery and several metabolic disorders can increase the concentration of calcium or oxalate in the urine. Struvite stones form in response to infection like a UTI. They can grow very quickly and become large. Uric acid stones form in people who are dehydrated or have high protein diets. Those who have gout, or I should say history of gout, this also leads, would give you indication that they have a high protein diet. Or people who have genetic factors may increase your risk. Cystine stones. It's a disorder that causes the kidneys to excrete too much amino acids. Kidney stones may not cause symptoms until they move around within the kidneys or pass into the ureters. These are the tubes that connect the kidneys and the bladder. Stones obstructing the uretero-pelvic junction. The pain is mild to severe, deep flank pain without radiation to the groin. You'll have some voiding symptoms, frequency, dysuria, suprapelvic pain, urinary frequency or urgency, having problems urinating or bowel symptoms. Stones within ureters, they cause severe colicky pain, meaning off and on. You'll have this colicky type for people who have children, colicky children, this kind of pain is off and on. In the flank or the ipsilateral lower abdomen, this radiates to the testicles or the vulvar area. It has a very intense nausea with or without vomiting. Upper ureteral stones, they radiate to the flank or to the lumbar areas in the back, so it's either on your side or to your low back. Then you have mid-ureteral calculi. These radiate anterior or caudally. Distal ureteral stones radiate into the groin or the testes in men or the labia majora for women. Here are some pictures where a person may be having some pain in their flank or their low back. Here's one on the flank side here that radiates down into the groin area in a male. Incident rates and statistics. 1 out of every 11 Americans will experience a kidney stone during their lifetime. 12 out of 100 men and 6 out of 100 women. So men still have a higher occurrence of kidney stones than women. Also, as the world's population evolves, so does kidney stone occurrences due to comorbidities associated with obesity, hypertension, diabetes mellitus, or I should say mellitus, aging, and global warming. With the global warming, when temperature is greater than 80 degrees, you have more reported incidents of kidney stones. The warmer the climate, the more people sweat or become dehydrated. You have these kinds of occurrences happening more often. So it puts people at higher risk. Prevalence increasing among women. Gender gap has narrowed due to changes in diet, lifestyle, and obesity. They have increased in women. Women who have a BMI greater than 32% body fat. Women have a higher occurrence of urinary tract stones. So they outpace men in that area, that kind of stone. But men still have a higher occurrence of kidney stones than women. Also, a higher intake of dietary calcium decreases the risk of urinary stones in young women, while supplemental calcium did not. Method of diagnosis. One, you would have to see your PCP, your primary care provider, or an emergency room doctor, or a urologist. These are the providers that will probably, be able to assist you in diagnosing you. You would have a urinalysis. This is a urine test. This can indicate if there's an infection, because a lot of times kidney stones are accompanied with an infection. Not all the time, but a lot of times. Or it can also indicate substances that form stones. Blood tests can indicate biochemical problems that can lead to kidney stones. So maybe one hasn't developed, but it can indicate things that are putting you at a higher risk. Abdominal x-rays or CT scans, they show the location of the stone, and they can also give you some clues on what condition may be causing the stone to form. Treatment, medication. Treatment of kidney stone usually depends on the size and what they are made of, as well as whether they're causing pain or obstructing the urinary tract. Small stones usually pass without treatment. However, people still may need some pain medication because kidney stones are very painful, very uncomfortable. You just can't go on with your everyday life. And people should also drink lots of fluids to help flush and move the stones through the urinary tract out of your body and your urine. Urinary retention medications, non-steroidal anti-inflammatory drugs, or diuretics may be given. Persons with larger stones or one that blocks urinary flow may need more urgent treatment. So seeking the help of a urologist probably would be the best bet, especially if you're having a larger one. This is a physician who has specialized knowledge and skill regarding problems of the male and female urinary tract and the male reproductive organs. There are some some medical procedures. The purpose or the objective of these medical procedures are to break the kidney stones, the larger ones, into smaller pieces so they can pass more readily, easier through the urinary tract in the urine. In most cases, these procedures will be done in a hospital with anesthesia. The first procedure is called the shockwave lithotripsy. This generates shock waves through the body that hopefully will break up the large kidney stones into smaller pieces so they can pass. The ureteroscope is another one. This is an instrument that has a camera on it. It's a scope. What happens as a little eyepiece, the tip of it will go and find, retrieve, and remove the stone. This scope is inserted into the urethra through the bladder, then into the ureters. This instrument generates a laser to actually break up the stone. Percutaneous nephrolithotomy. This is a tube that's inserted directly into the kidneys through a small incision in the back. Now, this one you might actually stay in the hospital a couple of days, 2 or 3 days. The other two normally are same-day procedures. But again, like I said, they'll be with anesthesia. The prognosis. Okay, so the outcome for people who seek medical attention early is great. They normally go on after treatment and they don't have any problems. So what their medical team will do is educate them on the right kind of diet, making sure they're staying hydrated to dilute their urine so they can prevent further occurrences. So if you've had kidney stones in the past, your chances of reoccurrence is greater than if you would have never had one. Kidney damage can occur if stones block the flow of urine out of the kidneys, 1 or 2. Some people only have 1 kidney, so that'll be a bad day. For most people with healthy kidneys, kidney stones do not cause serious kidney damage until they completely block the urinary tract for 2 or more weeks. This can also lead to kidney failure if your kidneys are blocked that long, because you won't be excreting, waste products. And my references where I found my information, you can check these links out at Mayo Clinic and the National Institute of Diabetes and Digestive and Kidney Disease. Thank you very much. And if you have any questions, give me an email. Thank you. Have a good day.